More on this, we're joined by Michael Tildesley, who is an Associate Professor of Life Sciences at the University of Warwick. Thanks so much for joining us on the programme. It's so confusing, isn't it? Do you think countries should be easing restrictions when they don't have the infrastructure in place to do mass testing and contact tracing, such as South Korea, for example?
So, I think it's important to realise that for many countries, we are in the relatively early stages of cases declining. And we need to have a coupled approach. Certainly in the UK in particular, there are gradual relaxations of lockdown coming into place. And it's important that all measures as they are released are gradual, because what we need to do is we need to prevent second waves occurring. Coupled with that, you're absolutely right. It is extremely important that as measures are relaxed, we test. We carry out testing for people who have symptoms and also trace their contacts. That's extremely important, because what we need to do, most importantly, is get those people identified rapidly, put in local controls, and hopefully prevent any of these large second waves occurring.
And Michael, the UK and the US in particular, they're going back to work when case numbers are still high, although they are falling. Do you think this is necessarily a disaster waiting to happen?
Well, I think it's important to realise in the UK, still a huge number of people will be working from home. We are starting that the advice is currently, if you are able to work from home, you should, and that will apply to a large number of people. They're starting to allow people to go back to work in non-essential jobs where it is not possible for them to work from home. But the key part of this is that needs to be done with social distancing measures in place, and that's extremely important. We need to be vigilant, and we need to adhere to social distancing and also good hygiene practices. But also, I think for these countries that are starting to ease restrictions, it's also important to be reactive. So if we start to see cases rising again, if we start to see pressures on the health service again, we need to be prepared to reintroduce some of these measures so that we can protect the health service and mitigate for this potential second wave.
All right, Michael, I'm going to put you on the spot a bit here. If you could describe what would be the perfect work environment for people going back to work with the best optimal social distancing and hygiene measures in place?
Well, I think it's important to say, unfortunately, in these unprecedented times, there is really no perfect solution when you're returning to work, because, of course, there is always going to be a slight increased risk when you're going to an environment where you're going to interact with people that are not in your home. All you can do is, where possible, maintain this distance from others. So try to keep desks apart. So the advice is a minimum of 2 meters apart. Don't congregate. So, if you're in a workplace that has like a kitchen, don't congregate in the kitchen and this sort of thing. Make sure that you maintain those distances all times. And if you're using communal areas, make sure that you're regularly hand washing. Keep up these sorts of practices. And if you are in close working environments, then in some situations, maybe using appropriate face masks might also be something that should be considered. So these are all kind of general advice. But the key thing still from a UK perspective is, if it is possible to work from home, then of course that is going to minimise your risk.
Michael Tildesley from the University of Warwick, thank you so much for that.